thank you guys so much for joining us. We're here this morning with Multnomah County Health Director, Multnomah County Health Officer, Dr. Jennifer Vines, Washington County Health Officer, Dr. Christina Baumann, and Clackamas and Washington County EMS Director, Dr. Ritu Sahni. They'll be discussing the surge in cases, the risk to hospital and emergency services ahead of the Thanksgiving holiday. And then we'll turn it over to you guys for questions. We also have Multnomah County Public Health Director Jessica Guernsey in the audience, and we're being joined by ASL interpreters Judy Webb and Alex Briavinen. With that, I am going to hide myself and turn it over to Dr. Vines.
Great. Good morning, everybody. Thanks for joining us. Again, I'm Dr. Jennifer Vines. I'm the Multnomah County Health Officer and the lead health officer for the Portland Metro region, including Clackamas and Washington counties. And you'll hear from some of their representatives today because our response to COVID-19 has most certainly been a regional effort. I think we want to get the word out very clearly that we are in a distinctly different phase of the COVID-19 pandemic heading into Thanksgiving. You've seen the numbers increasing quickly and dramatically in the last 3 weeks. Our hospitals are busy. Our 911 service is fairly busy, and you'll hear more about COVID through the lens of our healthcare providers from Dr. Sahni shortly. You'll also hear from Dr. Christina Baumann about how local public health is changing its approach to case investigation and contact tracing, just given the sheer numbers that we're having to handle on a daily basis at the local public health department level. I think our key takeaway is one last chance, hopefully, to reach people to cancel or extremely dial back their Thanksgiving social plans. Given what we've seen in the past, whenever there is a holiday that involves a lot of food and gathering, we tend to see an increase about 2 or 3 weeks later. And the way things are now, an increase 2 to 3 weeks from now would land us in an extremely difficult position across the metro area as far as hospital beds, potentially emergency response times, and just generally our ability to respond and manage this virus and frankly save lives. So with that introduction, we'll be around for your questions. I'm going to turn it over to Dr. Ritu Sahni, the EMS Medical Director for Clackamas and Washington counties.
Thanks, Dr. Vines. I want to start by recognizing the fact that this is a very difficult time and certainly not something that we take lightly. The last 9 months have been difficult for all of us. It's pretty natural that in times like this that we look to family as comfort. Personally, Thanksgiving is a time in which my family often travels, gets together to celebrate. And so we understand that this is difficult, but the reality is that we know from what we've seen in other regions that it can get much more difficult than what it looks like today. And so I just want to talk a couple minutes about what that could or would look like. With regards to our hospitals, the hospital system is at the brink right now, and a significant surge 2 weeks from now could very quickly overwhelm them. And what we know from, again, other situations in other locations throughout the country, that this surge can happen rather rapidly. And what does it mean for you if this happens? Well, it means that if you require emergency care, that care could be delayed. It means that if you go to the emergency department, that you would be waiting longer. If you have severe pain from some type of injury, you would have to wait longer for pain relief. And it also means that diagnosis and identification of sort of severe conditions would be delayed, as again, the entire system would be backed up. And in the worst case scenario, it means that if you have severe life-threatening conditions like trauma, heart attack, or stroke, that the emergency care that you require could be delayed or, in a very terrible situation, unavailable. And so that's how it would affect the hospitals. When we talk about our emergency response system, our EMS system, if we reach a point where the EMS system is overwhelmed, we could end up with situations where there are delayed responses. We could end up with situations where patients are no longer taken to the hospital, but are taken to urgent cares or potentially left at home. And in a worst case scenario, there would be no response. If hospitals become overwhelmed and you call 911, it may be that you end up having to go to a hospital that is much farther than the one that you would normally go to, or one that is a different healthcare system than the one where you usually seek care. And then if things get really bad, you could call 911 and nobody would come. And we have to have all of this planning in place. And we're starting to do that planning, or we're working towards that planning now. Hoping we wouldn't have to go there, but as an emergency person, we sort of hope for the best, but plan for the worst. And then finally, in my comments, I just want to mention, as a frontline emergency department physician, that my partners, the nurses, the techs, the housekeeping, EMTs and paramedics, all of your healthcare workers, we're pretty worried about what's going to happen after this holiday. The people who are responsible for your health and safety are scared. And we're all in this together, and we really need your help. So with that, I'm going to turn it over to Dr. Christina Baumann to talk about the public health alteration and response.
Thanks, Dr. Sahni. Hi, everyone. I'm Christina Baumann. I'm the health officer with Washington County. And I want to start out with talking about what we're seeing in public health and how we're responding. So the rapid rise in cases has made us change how we're doing our work. We are definitely prioritizing reaching out to reaching out to cases so we can identify where there might be disease spread and focus our resources on stopping the spread where people are most vulnerable to getting very sick. So we're diverting our staff to focus on that. And in so doing, we are asking the public to help. We are asking for your help, first and foremost, to take precautions to stop the spread of the virus and to avoid getting exposed yourself. The other way that we're asking you to help is that if you do test positive, if you have COVID-19, please reach out to your close contacts right away. Public health is doing our best to keep up and to do our outreach and education, but the fact of the matter is your outreach, your calling your close contacts and notifying your employer will be much more timely. So in calling your close contacts, we are asking that you tell them that they've been exposed. Ask them to quarantine for 14 days since their last exposure, watch for symptoms, and get tested. We know that this is a lot to take in, and we have results put together in the region, something that we're calling the After You Get Tested Guide. This is available on the Washington County website, and it's also available on the Multnomah County Public Health website. It walks you through all of the important information, including how to figure out how long you've been contagious, who to prioritize in notifying as a close contact, and also some tips on how to do that notification if you're uncertain how to begin and what information to give. So please, we're asking everyone, take a look at this guide. It has a lot of useful resources and information. And if you test positive, help out public health and notifying contacts yourself. The other way that you can help, and we mentioned how quickly the virus is spreading. This holiday that's coming up, Thanksgiving, as with other holidays, people get together and the virus spreads when people get together. We also tend to drop our guard when we're around people that we know. We don't take the precautions that we otherwise should. With Thanksgiving falling in the winter months, we will be celebrating together indoors potentially. And that's a big risk for spreading the virus. We are, as Dr. Sahni mentioned, as public health, as healthcare providers, very worried about what December is going to look like. And so we have to ask that people really strongly consider changing their holiday plans, changing their Thanksgiving plans. Please gather in smaller groups, don't travel, and protect your friends and family members who are older, because they absolutely can get very sick. We are very worried that we'll be hearing some sad stories going into December if the usual Thanksgiving gatherings happen as they have in other years. This is not a typical year. We are in the midst of a pandemic, and we are also at a time where we are seeing a lot of virus spread. So please take that into consideration as you think about how you're going to celebrate Thanksgiving. I can tell you that I and my family have absolutely thought hard about this, and our usual Thanksgiving, since my family and my husband's family are all in the Portland area, involves having 2 days to gather together and have meals at our households. We typically have 4 to 5 households coming together, and we are not doing that this year. It is not safe. My parents, who are in their 70s, are going to celebrate at their own home. My sister's family is going to celebrate at her own home. And I'm going to celebrate at my own home with my husband's sister and her husband. And the way that we're going to connect is by video. We will share our toasts and our Thanksgiving and spend some time together virtually. That's the safest choice for us, and a way that we can avoid adding to the spread of the virus in our community. So I'll stop there. Thank you.
Thank you all for those words, and I think we can open it up to questions. I am going to again turn off my video, and then if reporters would please unmute yourselves. For those calling in by phone, if anybody is, just dial *6 to unmute yourself. And we're also going to be posting a recording of this afterwards on YouTube. So if anybody has trouble with recording, just circle back with me after. With that, I'll open it up to questions.
This is Andrew Thien with the Oregonian. How close is the 911 system to being overloaded? You noted it was fairly busy, but I mean, at this point, is it a concern, or I guess could you quantify that compared to the hospital bed situation?
I'm assuming that question is for me. The 911 system today is not overloaded. We are functioning pretty much at standard. What we have had in the last month or so is an increased frequency of diversion in what we call active zone management, in which the patients are distributed amongst hospitals in what we would call a round robin type of format. And that has been higher than is typical for the last month, although it's not uncommon during sort of flu respiratory season. As we move forward, if we see continued exponential growth of the virus, as well as increased or decreased hospital capacity, that would then back up into the 911 system.
Hi there, this is Kelly Ozair from K2 News. We have a question about hospital capacity. I know a number of hospitals in the Multnomah County area are preparing to be overloaded. What are things hospitals can be doing? What is the counties doing? And how are we looking when it comes to capacity? Is there a concern that we won't have space for people?
Yeah, thanks, Kelly. I think I heard your question. I'll take a stab at that answer. So counties and hospitals are working really closely. The county function has to do with our EMS medical directors like Dr. Sahni and his counterpart in Multnomah County, because they have the authority to change protocols and to send less ill patients to places other than emergency departments. So we're handling that piece. Hospitals all have surge plans, and these were developed in the spring when people very helpfully did the Stay Home Save Lives order that bought all of us time to get those plans in place. So we now have almost minute-to-minute monitoring of staffed bed capacity. We have agreements among hospitals about how to take an influx of patients and ways that they can expand how many patients they can take at a time. And so there's a lot of attention initially on canceling what we call elective procedures, but these are, for the most part, procedures and surgeries that people need to have. They just may not need to have it right this minute. And unfortunately, our hospitals did say that they saw some poor health outcomes related to those delays from last spring's opening up, anticipating the wave that didn't come then, but clearly seems to be on its way now. So that's the short version. There are ways to expand hospital capacity, but we do start to bump up against primarily staffing limitations as staff themselves get infected in the community and have to be on isolation or on quarantine.
And then if you'll allow me a follow-up, sorry, here, hopefully you can hear me a little bit better. If you'll allow me a follow-up on that, last spring, obviously, we were talking a lot about the possibility of surges and overflows and being concerned about that. Are we in a better position now from what we've learned over these last 9 months to treat those who may come down with the coronavirus?
I would say yes. I would say what's different from last spring. So last spring, we were flying blind. We discovered that COVID-19 was here. It was being transmitted in the community. We didn't have the testing then to have a sense of how widespread it was or how many people might have created that first wave of illness. We also had limited personal protective equipment, if you all remember, and we were still learning about the virus itself. So thanks to that Stay Home Save Lives order, we got time to get personal protective equipment supplies essentially back to normal. Surge plans in place, more learning about the virus, treatments emerging, and patients generally doing better as long as hospitals are not overwhelmed. So unfortunately, we see death rates go up from this virus when hospitals get overwhelmed, and not everybody gets the level of care that they would under more normal circumstances. So in some ways, we're in a better position. I would say this time around, though, however, with cases going up everywhere, essentially, and everywhere strained, we have to pretty much depend on our local workforce. I don't think we can count on much help from out of state or elsewhere. So again, we are all in each other's hands here in the Portland metro area and more broadly in the state of Oregon to get this right these next few weeks. And I don't know if anyone else wants to add anything.
Hi, I have a question. Can you hear me? Are you at all concerned about testing capacity? I've heard there's like hours-long lines and, only limited personnel there too. So is that something you are at all concerned about?
Yeah, so I can answer for Multnomah County, and then I'll see if Dr. Baumann wants to comment for Washington County. We are seeing longer lines at the Multnomah County community testing site. I think at this point, with the changes in contact tracing that Dr. Baumann outlined, the goals of testing are a little bit different. So we want people who have symptoms or who have had close contact with someone known to have the virus to get tested. Not so much because we're going to be able to call you and do the contact tracing piece, but because we still want to know what disease spread looks like. We still want to understand the volume and the types of spread that are happening locally. And we also want you to know for your personal health. So if you are someone who's elderly or you have underlying medical conditions, you need to know that you have the virus because typically people will take a turn for the worse if they're going to at around 1 week after their symptoms start. And that's when we're going to need you to get the health care that we hope is going to be there when you need it. And I don't know, Dr. Baumann, if you have any else to add for Washington County.
Yeah, so similar to Multnomah County, yes, our testing centers are seeing long waits. What I would recommend is if you want to get tested, if you need to get tested, first reach out to your healthcare provider to find out what avenue would be the smoothest for you to get tested. If you are going through a testing site, an urgent care, a pharmacy, I'd recommend that you call them or check their website first to find out if you need an appointment or what other criteria you may have to meet to get tested there. That could make your experience more smooth.
Hey, Liz Birch from Coin6 News here. I have two follow-ups to that. My questions are for Dr. Vines and Baumann. First of all, are Multnomah and Washington counties doing any contact tracing from here moving forward, or is that falling specifically on the individuals who test positive to call their close contacts? And my second question is, do we have enough tests, and is there a backlog of testing?
I will take those questions. I'll start with the backlog first. There was a backlog of tests getting entered in the system, so you may have noticed some very high numbers from Multnomah County over last weekend. Those were largely backlogged cases that were just coming through the system. To the question of is there enough testing, it depends on the goals of testing. I would say if people are being turned away from testing, then by definition the answer is no, we don't have enough testing. I think this is an area where we have expanded, and a small portion of our increase in cases is from expanded testing. But ideally, testing should be readily available anywhere, anytime somebody wants it, with very few barriers. I think that's the goal. For Multnomah County, we are still doing some contact tracing. We have prioritized that workforce to focus on things like high-risk settings, like long-term care facility outbreaks, communities of color, African American, Native American, which we know are disproportionately affected by this virus. And so we are having to prioritize. We do want the message out broadly, though, so that people know what to do if they test positive, because that opportunity to keep yourself at home for your 10 days and to get to your contacts is going to happen more quickly than public health can make it happen at this point. And so that prevention opportunity right now really is with the public and our healthcare providers, which is why we're promoting our after testing guide so that people have the information they need to act quickly.
Yeah, thanks, Dr. Vines. And for Washington County, we're making very similar shifts. So we have staffed up as much as we can, and now we're reassigning our staff to focus on outreach to people who've been diagnosed with COVID-19. We are asking those individuals to notify their own contacts. If we find out that they live or work in a high-risk setting, such as Dr. Vines mentioned, such as a long-term care facility, a shelter, some other residential settings where people are at higher risk for getting really sick, our staff are prioritizing our technical assistance and our testing resources to help stop the spread in those environments. So we are absolutely prioritizing. We may not be able to reach out to the contacts of all of the cases that we identify. We are certainly going to try. As Dr. Vines mentioned, the most timely thing is for you to notify your own contacts and notify your own employer if you were working while you were sick and contagious. That will get things in motion much more quickly and help get people the information that they need sooner.
OHA said that they're working on vaccine distribution plans. What's the responsibility, or what responsibilities do counties have in preparing for a vaccine?
Yeah, thanks, Lister. So the question was about the responsibility of counties to prepare for a vaccine. So we do work in a public health system. So state works with counties as far as vaccine planning and identifying distribution sites and priority groups. In addition to responding to this surge and trying to get as much prevention out there as we can, thanks to all, getting our messages out. We also are having to do some basic planning for COVID-19 vaccine. In addition, I don't have a lot of details to share at this point, except that yes, that is another piece of work that comes to your local public health department at the county level in consultation and in close collaboration with the state.
Hey, this is Andrew Thien again. Going back to the contact tracing. So, I mean, can you quantify the number of investigations happening now? And forgive me, I haven't covered this as closely, but is this explicit call for people to effectively do their own contact tracing? Is that new? Is this the first time you've made that overture, or have you said that previously?
Yeah, thanks for the chance to clarify. This is new. So when cases were low enough and public health ramped up enormously to keep up with cases and to do contact tracing, and as a public health approach, that actually can be effective in containing the spread of a virus. Unfortunately, that effectiveness quickly erodes when the volume becomes as high as it has. So we shared with Multnomah County elected officials last night that we're basically reaching, and Jessica Guernsey will correct me if I'm wrong, I think we're reaching about half of our current cases in Multnomah County at the moment, which is why just broadly, we want people to know what to do. And yes, this is new. So it's not wait for public health to call you. It's refer to the after testing guide to know what to do to isolate, how to figure out who you need to tell, where your contacts, and how you all can access resources for your isolation and quarantine period.
And when you say half of cases, Dr. Vines, are you talking about half of existing cases or half of each day? What do you mean by that?
Half of reported cases to Multnomah County in rough numbers.
Okay, thank you.
Folkers here from KGW. You know, with the governor saying, you know, call the police on your neighbors over the weekend and, you know, having that call to action, what do you want people to know about contact tracing and about reporting when they have COVID, when there might be a little reluctancy, a little bit of fear to report for retaliation or that they might get in trouble? What do you want people to know about that?
So I can't speak for the governor around her plans for enforcement. I think her intent there is to convey how serious the situation is, which the three of us are also trying to convey with your help today. So I think as far as people getting tested and notifying their contacts, that's just the right thing to do. No one in the contact investigation, contact tracing, or support systems is going to be in an enforcement mode. We are essentially people dedicated to helping and to making it easy to do the right thing to slow transmission. So I don't know if my administrator, Jessica Guernsey, has more to say about enforcement within Multnomah County, but that's at least the spirit with which we approach public health.
Yeah, this is Jessica. Can you all hear me okay? Okay. Yes, I would totally agree with what Dr. Vines just said, and just sort of going back to what's already been stated several times in terms of the situation that we're in. You know, I think of public health as a verb, and this is really a call to action for folks to be part of a solution in an unprecedented time. I know it's very difficult for folks to make sacrifices, especially when it concerns not seeing family members. You know, as Dr. Baumann talked about her family plans, we too as a family have made significant changes to our plans as well, and we're going to stay in a bubble here in Portland. I have a 74-year-old mom that I want to protect, and it's very, very important to me, and I have that choice, and other people may not have that choice. So for folks that do, we really are asking for your help. We want you to be part of the solution. We're in each other's care right now, and we can make a difference. So I really want to underscore that point and how important that is.
Hi, this is Nick Budnick with the Portland Tribune. I was wondering, can you, and I apologize if I missed this part, but can you tell the public how the risk created by Thanksgiving gatherings and travel, holiday travel, compares to the risk of Black Friday and kind of shopping, holiday shopping? I've heard some people raising concerns about that. I don't know where you all come down, and I apologize if I missed that part.
Yeah, thanks, Nick. I think, you know, our message is a simple one. It's basically stay home and keep to your household if you possibly can. That goes for Thanksgiving, that goes for Thanksgiving travel, and that also goes for Black Friday. So thank you for bringing it up. You didn't miss it. So in a normal year, this would be a busy time of socializing, gathering, people moving around. We are all, I think, obligated to re-examine our plans. As Dr. Baumann said, it's an extraordinary year. This Thanksgiving simply cannot and should not look like it has in past years, given where we are with our health systems, hospitals, and first responders.
Thank you. And could I ask, have you seen a change in behavior that is driving these skyrocketing numbers? And again, I apologize. Is this strictly weather driven or is it something else?
I think, and Dr. Baumann can weigh in here, I don't think we have a simple answer to that question. I think it's the perfect storm of COVID-19 fatigue, colder weather, and I mean, and people's natural human drive to socialize and being driven indoors. I think those are our hypotheses. We could speculate about, did the wildfires spread things around? It's really hard to say. I can say that there's no single outbreak driving these numbers. And I can also say that as these just sheer case numbers, the volume of case numbers continue at these levels, sort of the more blurry our picture is of viral transmission. So we start to, we try to get our best grasp of what's happening with viral spread in our counties, but it's not as precise as when cases are lower and we're able to interview each one. And I see Dr. Baumann is on video, so I'll let her add to that.
Yeah, thank you. I agree with what Dr. Vine said. It's no one thing. What did change pretty notably is the weather, and people headed indoors when they may have socialized outdoors. Now they're doing it indoors. We have seen quite a bit of spread within households. So if one person in a household gets sick, many others in that same household get sick as well. And that has a lot to do with how closely we live together and being indoors and in smaller spaces together. So when you take that information and extend it to what happens when people socialize within each other's homes, it could be a very similar phenomenon. And so with Thanksgiving coming up and potentially people looking to gather over a meal indoors, there is a very large risk for spread to really add more fuel to the fire.
Great, thank you both. I have a question for Dr. Vines if no one else is jumping in. Dr. Vines, I know you have sought to sort of defer to the state's leadership and restrictions on gatherings and that sort of thing, but I also know that your office has worked to kind of encourage them to take action when you see fit. Can you speak to what interactions you've had with them over this new situation and whether or not you've discussed or explored other restrictions or varieties of restrictions other than what the governor has issued?
Sure, so I can share that the 3 county chairs, the Washington, Clackamas, Multnomah county chairs, are in regular contact, including with their local public health administrators and health officers. They're also in regular contact with the governor. And I can say that we were all pretty much thinking the same thing at the same time as case numbers started to take off. I wouldn't say I defer to the state. I think we are in a state framework for enforcement and approach to COVID as we have been from the beginning. Although our elected officials are very concerned and very dedicated, I think, to making good decisions and doing that with the state as opposed to working against each other. So we do have opportunities for input with the governor. She makes her own final decisions, and I'm not aware of anything potentially new on the horizon from her office, if that answers your question.
Well, what input have you shared with them in advance of this latest freeze?
I think we were definitely in agreement initially for the 2-week cause, and then ultimately supportive of the 4 weeks for Multnomah County for the reasons of case volume and the fact that Multnomah County houses the majority of hospitals. So with an eye to really the support role that we play for the entire state.
Thank you.
I have another question, if you don't mind. It's about PPE. Yesterday, I spoke with the Nurses Association in Oregon, and basically they were saying that they're concerned that there may not be enough PPE available should this surge continue and happen. I know we have a backstock, but how long will that last us realistically, and should we be concerned?
Yeah, so I am not hearing concerns about personal protective equipment. I think we need to be humble and cautious, because given the surge really in so many parts of the country and potentially parts of the world, and we've seen what can happen with supply chain disruptions, I think we have to be vigilant. And again, the last 10 months have bought us time to figure out how to properly conserve masks, use alternatives, and figure out what is the best protection for our frontline healthcare workers, so that we can adjust accordingly. So I'm not hearing of anything urgent, but it is something that we keep an eye on.
I'll ask another one, I guess. Dr. Vines, I'm curious, we all in the media and get a lot of, people saying that this is all a hoax, and we see all these, misinformation campaigns, people in other states going into hospitals, things of that nature. Has any of that percolated up to you or to your office? Is that something that your staff are having to deal with?
I hear directly from constituents. It's rare that I get a message like the kind that you're describing. What I would say to those people is it would be an awfully large, complicated conspiracy with a lot of people involved. I think for that to be the explanation for COVID-19, again, this is across different countries, different scientists, different political leaders. And if anything, please listen to our local first line EMS responders, hospital workers, who can tell you exactly how real this is.
Well, and if I could jump in just to dovetail with that, I would just say that, like Dr. Vines, I get plenty of constituent emails and phone calls with questions. And I would say it's not so much about, potential conspiracy theories and whatnot, but I would say that what I more generally see is perhaps folks not taking it as seriously as we are stating today. And I know it's difficult sometimes when things aren't completely evident to your eyes when you're hearing about things, but like Dr. Vine stated, our EMS and healthcare and medical colleagues that we've heard from today and in other press conferences, I just really want folks to hear those words. Dr. Vines and I were talking to our FQHC director yesterday about our colleagues in our FQHC system, and they are working to protect people's health every day, and they're putting themselves at risk. We're obviously taking appropriate precautions with PPE and all of the OSHA regulations to protect people, but folks are out there and once again putting themselves potentially in harm's way. So it's our shared responsibility to bear the burden as well and reduce our risk so that people are not being put in harm's way. So for me, it's not so much an issue of, I definitely see that storyline around conspiracy theories. I don't hear it as much from our own constituents. I hear, generally more about people maybe thinking it's not going to be or is as bad as it is.